Hi, everybody. Michael Tipton, president of the Blue Cross and Blue Shield of Louisiana Foundation. It's good to be here with you all today. And I have the honor of being able to ask some questions to Emily Chatelain, who's running the 3 O'Clock Project, which has really jumped out as one of the amazing star organizations who are responding to the needs of kids and families across the state of Louisiana in response to COVID-19. So, Emily, take us back to the beginning. What is the genesis of the 3 O'Clock Project? How did this organization start?
I started it about 4 years ago. I have always worked in schools on their school nutrition program. I consult with schools throughout Louisiana and the U.S. And through that work, I really saw a need for healthy meals after school and during summer months. A lot of the schools we work with are kind of on skeleton crew, but they don't have a lot of admin that could now do this whole entire after-school feeding program. So that's how it kind of started. We dove into it, we applied, we got approved by the state of Louisiana to become an after-school meal sponsor. And then that bleeds into summer, where summer has a much higher rate of childhood food insecurity. So we also do breakfast and lunch over the summer for all of our summer meal partners.
That brings us up to where we are today. So you all were a nonprofit that was able to offer after-school meals, able to offer summer meals. And then COVID-19 had an impact on the state of Louisiana. Talk to us about what you all are doing today and how that has had an impact on kids across the state of Louisiana.
About a month and a half ago, we just had 2 employees and we served about 300,000 meals in a year. And that's kind of where we were projecting. Fast forward to now, we have 350 employees and we're serving 60,000 meals in a day. So we're projecting about 300,000 meals easily in a week. Parents are coming through and they're able to see a smiling face, and it's been really uplifting, I think, for families that are going through such a stressful time, that this one constant, we know that we will have healthy food consistently every day. It's just one less thing to worry about on top of all of these new worries. It's been a really neat project, if you will, to serve all scopes of people who are kind of all in this together. Right now we are serving all of EPR and surrounding parishes, Ascension, Assumption, Iberville, St. Landry, and we've expanded into Lafayette parishes and Acadia Parish. We're also serving in New Orleans and Jefferson Parish, Plaquemines Parish, and Orleans. And really, we're preparing to go to any districts and parishes that are reaching out at this time, because we just want to get kids fed and we don't want to say no. So we're trying logistically to figure that out.
The Blue Cross Foundation made a $50,000 grant to the 3 O'Clock Project. It was one of our first. You had specifically stepped up, and we were proud to be able to make that grant. So help us understand what that $50,000 enabled on behalf of kids and community.
Blue Cross Blue Shield Louisiana Foundation was the first group to reach out to us and say, we see what you're doing and we've got this grant opportunity and we think you should apply. And that has been absolutely, clutch in what we're doing, because it really kind of gave us all renewed energy to say, we can do this, we will get funded when we need it. There's organizations out there that care too, that want to help us and help what we're doing. So that grant alone really sparked, I think, a lot of future and forward movement. We were able to immediately start buying and getting all these supplies that we need to get this done, in a grab and go method. And I really think it kind of, announced and sparked others to pay attention to what we're doing and to help us. So that was just an incredible kind of kickoff to what we're doing. And now, the scope of what we're doing is so much bigger than 3 weeks ago. It's been an incredible help. I hope that this can be an opportunity to show other organizations and communities that we can work together and take care of the kids in our community. We should all be working together here to make sure that these kids are set up for success with basic needs.